Hi, I'm Megan Stone, and this is Donna Roper, and this is California State Proposition 34. You'll see it on your ballot as restricts spending of prescription drug revenues by certain healthcare providers. It's an initiative statute. Donna, can you please tell us the question Prop 34 puts to the voters?
Sure, Megan. Prop 34 poses the question: should certain healthcare providers be required to spend 98% of revenues generated from the federal discount prescription drug programs on direct patient care?
And what's the background on this prop? Can you give us the current situation?
Medi-Cal is a federal state program that provides health coverage and pays for prescription drug costs for low income people. The federal drug discount program provides discounts on drugs to healthcare providers like a Kaiser Permanente who meets certain rules.
And who receives federal drug discounts?
Eligible providers are public or private nonprofits that focus on serving low income people. And state law prohibits providers from charging Medi-Cal more than the discounted price of the drug.
Is there any oversight on these discounts?
There's currently no requirement or oversight on how revenues earned from the federal discount prescription drug programs are spent.
What does Prop 34 propose?
Prop 34 creates new rules about how certain healthcare entities spend revenue from a federal drug discount program. Specifically, the entities would have to spend at least 98% of their net revenues earned in California on healthcare services provided directly to patients or direct patient care.
Would this requirement apply to all healthcare entities?
No, healthcare entities must meet the following criteria. The entity participates in a federal drug discount program. The entity has or has ever had a license in California to operate as a health plan, pharmacy, or clinic, or has had certain contracts with Medi-Cal or Medicare. The entity has a 10-year period where it spent more than $100 million on purposes other than direct patient care discount programs. And the entity owns and operates or has previously owned and operated multifamily housing units with at least 500 violations with a severity level of high.
Is there any oversight in Prop 34?
Prop 34 requires affected entities to report their revenue and expenses annually to the state. The state can charge affected entities fees to cover any enforcement and penalty costs and operating restrictions.
What would be the fiscal impact of Prop 34?
Prop 34 would increase state costs, likely in the millions of dollars annually, to enforce new rules on certain healthcare entities. Affected entities would pay fees to cover these costs.
What are supporters saying?
Supporters say this is a simple case of accountability. When the federal government gives discounts to healthcare providers, taxpayers deserve to know that the money is being used to help the neediest patients. They also say this proposition would provide much needed transparency and rein in abuse.
And what are opponents saying?
Opponents say that Prop 34 is an attempt by the California Apartment Association to harm a specific healthcare provider, the AIDS Healthcare Foundation, that supports rent control. They also say that Prop 34 weaponizes the initiative process, so no organization in the future will be safe from retribution.
What about campaign financing?
So far, 18.5 million has been contributed in support and 532,000 has been contributed in opposition. See the top donors on your screen.
All right, wrapping up. What does a yes vote and a no vote mean on Prop 34?
A yes vote means that certain healthcare providers would be required to spend 98% of revenues generated from federal discount prescription drug programs on direct patient care. And a no vote means these new requirements would not go into effect.
Great. Thank you so much, Donna.
You're welcome, Megan.